Next, we will exercise the hinge joints of the body. These are monoaxial joints, which allow flexion and extension between the concave surface and the convex surface of articulating bones. The elbow allows for flexion and extension because of the hinge joint between the trochlea of the humerus and the trochlear notch of the ulna. Please follow along with the students as they flex the elbow in pose 1, which is known as the argue with a werewolf pose. This is followed by one elbow returning to anatomical position and extended, while the other is flexed in the pose known as measure the height of the elf, and then ending with both elbows in anatomical position and extended. The knee is also a hinge joint involving 3 bones: the femur with its medial and lateral condyles, the tibia with its medial and lateral condyles, and the patella, which articulates with the patellar surface of the femur. This hinge joint allows for the flexion and extension of the lower leg. Please follow along with the students as they begin in anatomical position with the knee extended, and then flex the knee, and then return to anatomical position with the knee extended. The ankle joint between the talus of the foot and the tibia and fibula of the lower leg is also a hinge joint, which allows for dorsiflexion as the toes curl upward and plantar flexion as the toes curl downward. Please follow along with our students as they practice dorsiflexion and plantar flexion using the hinge joint of the ankle.